Hello, we are group number 3. We will be doing a role play activity based on our renal case study. So our case study involves our client, MJ, who will be played by Lacey. And then we have our doctor, who will be played by Taylor. And our registered dietitian will be played by Cynthia. To give you a quick recap of our patient and her condition, MJ is 23 years old. She is a woman that suffers from systemic lupus erythematosus, and this is complicated by lupus nephritis. She was admitted to the hospital with a fever and chills for 3 days. She's been managing her chronic renal failure with dialysis for 3 years. She was also experiencing intermittent nausea and vomiting, and that's been associated with involuntary weight loss of 6 kilograms over the past 4 months. We will be doing our role play staged in rounds at a hospital. So we will first hear from our doctor.
So MJ's lab values are relatively normal. Her hemoglobin and white blood cell count are a little bit high, but nothing extreme. Her BUN and creatinine are severely high, though, which indicates severe kidney disease and dysfunction. These lab values are most likely caused by her intermittent noncompliance with dialysis at home. Blood cultures were taken and a chest x-ray were ordered. Dialysate was collected from her dialysis site for culture and gram stain. Staph aureus was detected and she was started on IV and intraperitoneal cefazolin for antibiotic treatment. A upper endoscopy was performed due to her ongoing GI problems, and she was found to have mild reflux esophagitis. A solid phase gastric emptying study was also conducted. This test determines the time that it takes food to move through the stomach. The results showed modestly severe gastroparesis. Gastroparesis is a condition in which the muscles of the stomach involved in motility are not functioning properly, and it prevents the stomach from emptying. This causes pain, bloating, nausea, and vomiting, all that she has been experiencing at home before her admission. In this case, we are attributing the cause to be uremia, which is a result of increased amount of urea and nitrogenous waste in the blood. These substances are usually filtered and eliminated by the kidneys in healthy individuals. This condition is common in CKD patients and patients on peripheral dialysis. This is usually caused by autonomic neuropathy, and symptoms improve once underlying disease is managed better. Certain drugs also help, such as metoclopramide, which she is currently on. Esophagitis is present in more than 1/3 of uremia patients. It's not necessarily more common in dialysis patients than non-dialysis patients, but it is usually caused by an increase in abdominal pressure, such as from gastroparesis due to inability to digest food. This results in reflux. And a common side effect is malnutrition. She had a NJ tube placed to begin tube feeding, which will be managed by the registered dietitian. She is currently on azathioprine and metoclopramide. She is also on cefazolin to treat her staph infection. She has been on this course of treatment for 2 weeks and has done well. She will be preparing for discharge with enteral feedings nocturnal. Education will come from dietary going forward. Are there any questions, MJ?
Yeah, actually, I have a few questions. Thank you for asking. So can you kind of explain what my medications do? I don't fully understand.
Sure. So your azathioprine, you were on before admission as well. It's for immunosuppression. So you are using that for your lupus as well as your peritoneal dialysis. The metoclopramide, you're only taking that PRN as needed. So it's a gut motility stimulator and an antiemetic. So it will help with that nausea, especially now with your gastroparesis. And as your gut heals, it'll help get things started again and help with that nausea and vomiting. And then your cefazolin is to treat your Staph aureus peritonitis.
Okay, that makes a lot more sense. Thank you for explaining. And then do you think that any of these medications will make me like experience more nausea than I like was already experiencing?
It can, just because you're not processing things correctly. So we will monitor that in the hospital as much as we can. It's important you let us know, and then also we some ice chips or other medications to help combat that if possible, as well as try to help with dietary recommendations.
Okay, perfect. Thank you for that. And then lastly, is there like once I'm at home, is there anything that I should avoid while like continuing these medications in terms of like food or drinks?
Yeah, so while you're admitted, we'll make sure none of that interferes. Your food and medications don't interfere with each other. But it is important once you're discharged and you go home that you stay away from alcohol as much as possible, especially with your antibiotics, because that can affect the efficacy going forward, as well as with your other medications.
Okay, great. Thank you so much. I appreciate it.
Oh, and now we will hear from the registered dietitian, Cynthia.
Hello, I'm the RD for MJ. Upon physical examination, we found a teen chronicle ill appearing woman with a temperature of 38.4 Celsius and a heartbeat of 112 beats per minute. NG height is 155 centimeters, and she's currently with a weight of 45 kilograms, with a usual body weight of 51.4. She has experienced intermittent nausea and vomiting with weight loss of 6 kilograms, and unintentionally lost 12% of weight over the past 4 months. Her nutritional diagnosis is malnutrition related to gastroparesis, esophagitis, and peritonitis, as evidenced by fever, bloating, chills, intermittent nausea, and vomiting with weight loss. She also has self-monitoring deficit related to the patient's being intermittently not compliant with her CAPD as prescribed. She requires 1.2 to 1.5 kilograms grams per kilogram of protein per day. Since she is in CAPD, patients with this dialysis need a higher protein needs due to the greater protein losses that they're having during dialysis. So also the fluid requirements are around 2,000 milligrams per day plus the urine output. Her daily energy needs are about 1,575 calories per day, with an intake of 1,048 calories and 510 calories accounted for the dialysate coming from the dialysate. Consider her new medical diagnosis of mild reflux esophagitis with no structural abnormality and gastroparesis. We place a NG tube and started her on the tube feeding. The internal nutrition we selected for NG is the Nepro with carb steady. This formula is nutritionally complete since during peritoneal dialysis, there are losses of protein, amino acids, and macronutrients that are relevant and they need to be retaken. And also there is an absorption of glucose increase during dialysis. So since this supplement has carb steady, is a carb steady formula, carbohydrates are blended and designed to help manage blood sugar response better. This formula is designed for people on dialysis to optimize electrolytes. And it has an excellent high quality protein to meet the nutritional needs and replace the protein loss during dialysis. Since protein losses during CAPD are higher than HD, and patient has been diagnosed with peritonitis, she will be with the need of higher amounts of protein, fluid, and sodium replacement. Our goal is to improve NJ nutritional intake and status through weight management by maintaining a BMI of 18.5 or higher. During transition to oral diet alone. So when the time comes to eat a diet alone. as well as improve digestive functions and maintain a goal of protein and energy intake of 30 to 35 calories per kilogram of her weight. She has been on this treatment for 2 weeks and of now with little to no complaints. Her nausea has improved with dialysis therapy and the NG2. She will be discharged on natural enteral feeding and intraperitoneal antibiotics for 4 weeks. She will be prepared for discharge from a dietary standpoint by advising a right and effective feeding regimen to improve patient general well-being, as well as provide the right training to improve patients' confidence with tube feeding administration and the transition to PO intake. She will continue the follow-up after discharge to ensure compliance and appropriate weight management. We'll see her in the next 2 weeks. Okay, so do you have any question for me so far?
Yes, I actually do. Thank you for asking. So how should I begin to incorporate food like by mouth? What's the easiest way to do that without any discomfort?
Of course, yeah, we can start with liquid diet, which is pretty much gelatins, broth. We can start with liquid diets and then move on with a soft diet, such as little pieces of banana, or for example, like papaya, little pieces, or little soups, and that will increase your strength in your digestive system.
Okay, perfect. That makes sense. And yeah, that sounds
And we're gonna,
good.
yeah, and we're gonna go more in detail. And we'll give you examples and guidance on the diet, so you can follow up on it.
Okay, perfect. Thank you so much. And then should I be taking any supplements for this next step?
Yeah, well, for now, since we want to see how how well you handle this diet for now for the enteral nutrition. So for now, we're not recommending any supplement, and if we see that it's necessary for the next weeks, we'll let you know. But so far, you're good. Maybe we will recommend some probiotics or omega-3. But so far, we see that with the food intake and the enteral nutrition, will be fine.
Okay, perfect. And then I do have one more question. I know you said high quality protein, and that just kind of scares me because I know dialysis patients, or I've heard that they shouldn't have a lot of protein. Can you explain that part?
Yeah, sure. I understand. Yeah, I understand the concern. You don't have to worry about it. Like, we're gonna be measuring the amounts of protein that you're gonna be intaking, and also during your dialysis, since in peritoneal dialysis, you lose a lot of the protein that you intake, so you need to take it back, right? So and it's necessary to try to eat more high quality protein coming from fish, chicken, animal sources, because that's a protein that tends to stay in your body the longer. Okay, so that's why. So you need about 1.2 to 1.5 grams per kilogram, and we'll calculate your portions, obviously. But yeah, it's slightly higher than a regular amount. So don't be scared or anything, because it's because of the dialysis that you are in. Yeah, and you also need extra fluids and extra sodium too. So you're gonna be fine.
Okay, perfect. Thank you so much. I feel much more comfortable. I think those are all my questions. So thank you for your help.
Okay, yeah. Yeah, sure. Any other question, let me know. We're here to help.
Thank you so much.
And to wrap up, following discharge from patient MJ, the RD, Cynthia, she will focus on individualized, consistent monitoring, which will be focused based on quality of life measurements, preventing malnutrition, and involuntary weight loss. Thank you for watching.